Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you for joining us once again. Now, is a plant-based diet the right choice for you? Our guest today is Dr. Deborah Clegg, and she's joining us with some vital information on the potential health benefits and some of the risks associated with a plant-based diet for patients with chronic kidney disease. Welcome to the program, Dr. Clegg. Thanks for taking the time. A bit of background about yourself, if you would.
Yes, so I'm a registered dietitian, and I also do research on metabolism. So I focus on understanding how our nutrients interact with our body.
Now, I did mention, plant-based diets specifically for patients with chronic kidney disease. Kidney disease and chronic kidney disease. What is chronic kidney disease? Is that something that you're just going to have it from now on and there's no treatment?
Not necessarily, but it is an indication that your kidneys are not necessarily working perfectly, and it's time then to stand up, take stock, and make sure that we're taking care of our kidneys. They're very vital organs within our body.
What is it about chronic kidney disease that sets it apart?
Well, so chronic kidney disease can actually be caused by having elevations in blood pressure or having hypertension, as well as diabetes and cardiovascular disease. And again, as I indicated, the kidneys are incredible organs within our body that maintain normal homeostasis. And so when they're starting not to work properly, we lose that homeostasis. And one of the specific areas that we lose the homeostasis is related to potassium. So having high blood potassium or hyperkalemia is actually considered to be lethal. And it's one of the concerns with individuals who have kidneys that are no longer functioning perfectly correctly.
So obviously keeping these potassium levels balanced or at their proper level, even with kidney failure or damage, is of utmost importance. So why is this potassium level so important? What is it about potassium?
Exactly. So potassium is it's a very critical element or nutrient within our diet. It actually helps regulate blood pressure. It decreases stroke risk. It decreases fluid accumulation and enhances nerve function. And the interesting thing about potassium is that when you have enough potassium in your diet, it actually can protect your kidneys. However, when all of a sudden your kidneys are no longer functioning adequately, then all of a sudden potassium becomes very dangerous. So it's sort of a yin and yang effect of potassium. And so what we're here to talk about today is that there are some newer treatment options for people whose kidneys or who have chronic kidney disease that may allow them to eat diets that are loaded with fresh fruits and vegetables. And these diets are also the types of diets that are loaded in potassium. The
plant-based diets that we're talking about, what is it about the plants, the potassium in the plants? Is it different from what a person may be taking if they're not eating this plant-based diet?
Well, not necessarily. So what we're talking about is that during chronic kidney disease, when the kidneys are no longer functioning perfectly, then all of a sudden we have to watch or monitor the amount of potassium we take in our diet. And the fresh fruits and vegetables tend to be products within our diet that are loaded with potassium. And so with these newer treatment options, what we now believe is that there's opportunities for people who have CKD or chronic kidney disease to actually enjoy the benefits of fresh fruits and vegetables. It's not to say that one fruit or one vegetable is better or worse than the other. What we're trying to do is we're trying to encourage individuals who have chronic kidney disease to talk with their doctor and see whether they might be eligible for these newer treatment options that can maintain potassium homeostasis within their bodies.
So what are some of these options specifically, and how do they differ from patient to patient?
Right. So not every person, this is one of the really interesting areas in research, actually, and that is that we're just beginning to understand that not everyone actually has the same concerns with respect to hyperkalemia, this high blood pressure or high blood potassium levels, and that it varies between individuals. But this is something that people need to go to specifically to their physician to discover and see whether they might be individuals who could benefit from these newer treatment options.
So there are obviously some risk involved with any type of treatment, especially when we're talking about the kidneys, such a vital organ. Talk about some of the risk. We've discussed the benefits, the balancing the potassium levels, things of that nature. But what are some of the risks associated?
Right. So having hyperkalemia or elevated blood potassium levels is actually lethal. Also, having too low blood potassium is also lethal. So these are two different extremes with potassium homeostasis that people who have chronic kidney disease need to watch out for. So just having the nice right line or the right amount of potassium in the body is absolutely critical. And then when your kidneys start to fail, this becomes even more critical to monitor very carefully. And that's when we encourage individuals to seek the care of physicians.
So is it because there are different causes of the kidney disease? Is that why it's so crucial to have an in-depth conversation with your healthcare provider rather than just go and do a shotgun effect treatment?
Exactly. So it's really, really important. It's not fun to sort of self-manage any of these types of diseases, especially when there's a disease affecting the kidneys. So we really encourage individuals, if they have any of these preconditions, such as hypertension, diabetes, or cardiovascular disease, to really monitor their kidney health with their physician, and then talk with their physician about whether they might be considered to be eligible for trying these newer products, which again will allow them to eat the fresh fruits and vegetables. It's this unusual balance between fresh fruits and vegetables are wonderful for your kidney, but as soon as your kidney function just starts to decrease, all of a sudden you have to be very careful of those same fruits and vegetables. So with these new products, what we're hoping is that individuals will be able to enjoy the health benefits of fresh fruits and vegetables while maintaining kidney function.
You know, through the years, and this is just my own observation, I have noticed kidney dialysis centers, kidney treatment centers in cities almost every 2 or 3 blocks or so. I mean, they're everywhere. In your opinion, is that because there are so many advancements in kidney treatment, or because we have been negligent as a society in some of the things that we're eating, neglecting these plant-based diets that seem to be so in the forefront of everybody's mind these days?
Absolutely. So there's about 30 million people who suffer from chronic kidney disease. And again, I think that your questions are right on. I think that our diet has contributed to chronic kidney disease, as well as our diet's contributed to hypertension, diabetes, and cardiovascular disease. And those were those 3 main diseases that actually impact the kidneys. So now is a time, again, when I think that we need to go back to the basics, try to enjoy fresh fruits and vegetables, shop in that perimeter of the grocery store rather than in the middle aisles where all the foods are processed, in order to preserve the function of our kidneys.
Well, where can our listeners go and get some more information about kidney health in general and about possibly what you do?
Exactly. So this month actually happens to be National Kidney Function Month, and so we encourage individuals to go to the National Kidney Foundation website, which provides some beautiful information about chronic kidney disease and hyperkalemia as well. This is just an important time. Not only is it National Kidney Month, but it's also National Nutrition Month, which reminds us that to take good care of our kidneys, we also need to eat a healthy diet. So that's really what we're trying to encourage individuals to do.
Well, I thank you for joining us here on the program today, Dr. Clegg.
Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Deborah Clegg, affiliated with Cedars-Sinai, UCLA, and the American University. Also lead study investigator on plant-based diets and folks with CKD, or chronic kidney disease. We've been talking about plant-based diets and the benefits and possible risks. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.